What are immediate implants? Hey guys, Dr. Stryker here from Lincoln Crossings Dental Care. This is a question I get sometimes from our patients when I'm describing some of the advances that we have seen in dental implant therapy and some of the newer things that we're doing here in my office in terms of giving patients the best possible outcome that we can. And so this is called an immediate implant. Essentially what this is when we have somebody who has a broken tooth, maybe it's infected, maybe they broke it, had an old root canal, whatever the scenario is, it needs to come out and they ultimately want to get a dental implant to replace that tooth. So essentially what we're doing is we're taking the tooth out and putting the implant in all at the same time. Now, why would we do this? Well, let me tell you. One is it saves you about 3 to 4 months of healing. So instead of going through the process of getting the tooth out, putting a bone graft in, letting that heal for 3 months, then getting the implant in for 3 months, we can do all that at the same time. So instead of 6 months of healing, you have 3 months of healing. That's pretty cool. Two is because we're doing everything at once, we really are able to maintain your natural anatomy and tissue just architecture so that there's no shrinkage. The tissue and bone doesn't go through a period of healing and shrinking, and then we're manipulating that again with an implant. So we're able to keep things as natural looking and as natural fitting as we possibly can. Now, why is that important? One is the more natural we can make an implant, the more it looks like your natural tooth. Now, not all implants will look like natural teeth. Teeth are shaped like this. An implant is completely circular. So naturally, an implant that's done the traditional way is gonna look a little bit different, not slightly, but a little bit. So for a very high aesthetic area, this is super important so that we can get the most realistic outcome possible. And then two, the other main benefit is this really eliminates a lot of food trapping in areas that are undercut and where plaque builds up. That's one of the main things we see with dental implants done in traditional route, where we wait for things to heal and then put the implant in, is it does create an area of food trapping. And it's one of the biggest concerns and complaints I hear from patients who have had dental implants is they just tend to get more food stuck and always have to have floss, which is annoying. Sometimes it is, it's just the way it is and it's not preventable. But when we're able to do immediate implants, we can take advantage of the body's natural anatomy and architecture and use that for our implant so that we get less food trapping, which will lead to less problems around the implant and around the teeth next to it. And we also make it look nicer. So there's a lot of benefits to immediate implants when we can do them. It has to be the right situation. A lot of times we can do this on front teeth and on premolar teeth. Sometimes we can do them on molars. It just depends on the scenario. So if you're thinking about getting a tooth removed and you want to look into a dental implant, immediate implants might be a great solution for you. That's going to give you a better looking result, a more functional result, and have less annoying food trapping. And also it's going to save you about 3 months of healing. So really consider it. We're always happy to answer questions. Thanks, guys.